Well, today on the show, we're talking to Dr. Avery here at the South Mississippi Surgical Weight Loss Center, part of the Singing River Health System. And
Correct.
It's good to see you as
Good to see you,
always.
Jim.
I know we've
Absolutely.
talked to you many, many times. If you would, just talk a little bit about, your philosophy here, your different weight loss procedure options that y'all have to offer.
Sure. Obesity is such a problem, and unfortunately, society and lots of patients still feel like it's the fault of the patient. And what we're trying to educate patients and the public is obesity is an illness, just like high blood pressure or hypertension, and it's just got to be treated. It's not a patient's fault. And when you approach it that way, we make it much more of a science. It's a clinical endeavor. Mm-hmm. How do we get somebody that is morbidly obese healthy? And that includes a treatment like surgery, but also we support people having healthy lifestyles, eating well, mm-hmm. exercising, and just thinking about how to be more healthy.
Now, is obesity, is it hereditary?
So, such a tough question. We don't understand all of this, but
I know Mississippi's #1 in obesity.
Correct. I think the hereditary component is real, but it's largely a cultural problem mm-hmm. about how we get here. But there are so many other things from our diet to effects of drugs and antibiotics on our body's mm-hmm. natural biologic world. So it's a very complicated process that we're still learning a lot about.
Now, you talk about lifestyle, people not eating properly. Do you feel a lot of it can be maybe peer pressure from family members or whatever?
About eating poorly?
About eating poorly,
sure.
yes.
So
I'm from the country, and I can't tell you the number of family reunions I've gone to in the past, and this country folks, they know how to put out a spread. Here, Granny said, here, have another piece of pie.
My grandmother told me to get everything fried if I could. And I know she loved me, and I know that she wanted me to do well, but we don't understand nearly as well about eating healthy, but certainly we're telling people the wrong thing, and we've got to eat healthier. Mm-hmm. And that's just a long-term problem to get corrected.
So when someone does come to you, with the problem, they finally have decided, I guess they have to go through their general practitioner first.
Well, however they come find us, they can just call. Mm-hmm. But we do start talking about eating healthy, and we have great dietitians, and we just kind of start re-educating people. And I find that from all walks of life, whether physicians, business people, folks that just work with their hands, there is a lot to learn mm-hmm. about nutrition, and most of us can do a much better job of how we eat. And I'm trying for me.
Oh, I know. I mean, there's just so much stuff that is not good for you that people think, well, as you said, here, this is fried, eat it good. But there's a lot of great foods out there that you can eat well.
Correct.
And not have to worry about
I think
that so much.
If we just get people to thinking a little bit more about avoiding so many worthless calories, mm-hmm. Fast food, junk food, snack food, all of that is what we try to get people to avoid, to try to eat it more simply, mm-hmm. a little more healthy. Most of us can do that. We do have access to so much food with such dense calories mm-hmm. that, if you go eat a fast food meal, I don't care where you get it, you're going to get 1,000 calories almost every time.
Oh, yes.
Well, in a diet that ought to be less than 2,000 calories a day, it's impossible. And so I think we all have to be a little more aware of what we're eating and why we're eating, because sometimes we don't eat because we're hungry, because we're bored, we have access to it.
Exactly.
And so all of those things people can do a better job.
Definitely. Well, you talked about diet and everything, and we're going to talk to a registered dietitian now here and find out the preparations that have to be done, and after you have the surgery, what you have to do. So, Dr. Avery, thank you so much.
It's a pleasure. Thank you.
Now, Abby Sniffen is registered dietitian here. How are you? Nice to meet you.
Thank you. Nice to meet you too.
Now, when someone's coming in to get the surgery, mm-hmm. there's some preparations that they have to do ahead of time, correct?
Right. We follow a structured program here at SMS. Every patient starts out with attending a 1-hour nutrition class. Mm-hmm. That's where they learn what to eat, what not to eat, how much to eat. We talk about meal prep, grocery shopping, how to read a food label, how to plan a menu, that type of thing.
Wow.
Yeah, then we move on to where the dietitian and the nurse practitioner, we see every patient that comes in once a month for a one-on-one visit. And that's where we help the patient to put into practice what they've learned in nutrition class. So
Right.
setting small goals that will lay a good foundation for smooth transition post-surgery. So we're talking about things like increasing water intake, eliminating sugary beverages, carbonated drinks, certainly establishing a meal routine and exercise routine. And then closer to surgery, all the patients attend another hour-long nutrition class, and that's where they learn about their new protein and vitamin intake, as well as how to follow a very specific food progression diet.
I'm sure that changes.
It does. We start out with clear liquids, they move on to full liquids, which are things like protein shakes, creamy soups, onto soft foods, and then beyond.
Wow.
Yeah.
Okay. Then they've gone through all this, they've had their surgery. So after that, very important as to the guidelines that they have to follow.
Absolutely. We're very specific about, following this diet, and they learn that in nutrition class. And I wanted to show you, this is a 1 ounce cup.
Right.
And after surgery, patients are only able to hold 1 to 2 ounces in their new pouch.
Wow.
So that's not very much.
No, it's not. I mean, without getting, I guess, sick or something.
Right. They've got to keep to the guidelines. Yes.
What are some of the keys? We have a little over a minute left. What are some of the keys to success?
I would say that successful patients they're starting their day with a healthy breakfast. They are keeping a food log, knowing their calorie level, calorie intake, exercise, very important, and keeping up with their clinic appointments and seeing their surgeon on a regular basis.
Now, I love this little sheet that y'all have put up here. 10 tips for healthy weight loss. Eat less, move more, make small, realistic changes. And a lot of people, every meal or snack should include lean protein and fiber. And you don't eat so much large items throughout the day.
Right, smaller meals throughout the day, probably about 5 or 6 times during the day, getting some protein and a healthy fiber.
And that's, of course, as you said, drink a lot of water.
Yes.
That's a very important thing.
Very important.
And then to where you get to where you, do much better. Thank you so much,
You're welcome.
Abby. Appreciate that.
Thank you.
If you'd like some more information, the phone number is on your screen. If you have or know someone who has had an obesity problem, needs some surgery, give them a call here at South Mississippi Surgical Weight Loss Center. They'll be glad to help you.